Horizon TV, the beacon for the nation.
Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakwetu wanatambua kama Mariam Mwacharo. Unatizama The Sabah Show. Assalamu alaikum wa rahmatullahi wa barakatuh. Kwa mara nyingine tena mpenzi mtazamaji, shukran sana kwa kuendelea kutegea the premier Islamic TV station Horizon TV. Uko nami Mariam Mwacharo. Leo we're talking about anxiety, but first we're finalizing on depression as we started last week. Now, mental health in general is regarded as a silent epidemic. It is sly. It's a creeper, and it slowly affects and deteriorates the life of the patient. Now, there's a lot of negligence and ignorance in mental health as an issue, and this needs to change. As we continue our mental health series, having already covered depression last week, we finish up on depression definitely this week. And as I mentioned earlier, these are the two most common conditions that usually affect, us here in Kenya, according to research rather. And joining me to delve into this issue, of course, is our very own, she's not new, psychologist Tima Khamis. Welcome to our show.
Thank you, Mariam.
We had her last week and we spoke about depression, and we also have with us Bwana Njau. Ameniambia tu nimwite Bwana Njau, ambaye amekuwa pia yeye ni patient wa depression, na ataweza kutuelezea his story very briefly, and I'm very, very excited to have both of you. Thank you very much for gracing our show today. If I may start with you, Bwana Njau. How did it start? When did you realize, oh, I'm probably depressed? Or how did it all start? Give us a brief of your story.
Okay, thank you. You know that saying, Rome was not built in a day.
Yeah.
So likewise, depression is not built in a day.
Mm-hmm.
You can't be depressed in one day. It's a series of events that lead you there. So to be brief, in short, when I joined campus, I joined with the mentality of self-discovery. I didn't just want to graduate with a degree and say, oh, I'm Njau and this is what I can do. I wanted to leave campus having known who I truly am. So when I was in freshman, I used to ask myself that question a lot. Who am I? What do I really stand for? Other than the fact that I knew I'm smart academically, there really wasn't anything much that I could say about myself. So I discovered that going along uni might not really get me the answer that I really needed. So I decided to drop out of uni. That was like 5 years ago. And I decided to pursue what I really thought is what I was meant to do in my life. Because another thing I do is I believe a lot in philosophy. My life philosophy is like true happiness is not found through self-gratification, but through fidelity to a worthy purpose. And I was just in search of purpose. I just wanted to feel that I am living a life that is making me happy and is giving me fulfillment. So I entered into that journey. I went back from campus. I found myself living with my mom in Nakuru. That was a whole other level of stress. Then I discovered if I stay in Nakuru, I'll probably not live my dream. So 4 years ago, I packed my bags from Nakuru. I'm in Nairobi. The first time in Nairobi, I've never been here before. I'm hustling left, right, center. Now all was going good. I found myself even going to Europe for business, and everything seemed perfect.
Wow.
But then I started asking myself, it's now 4 years after I've quit campus, but have I discovered who I am? And I discovered I'm still where I was in my campus dormitory. I still don't have an answer to that question. So really pondering on that question, who I am, what do I stand for, it's my purpose, I can say is what led me now to say, okay, now this is getting out of hand.
Yeah.
I really need to either talk to someone or get specialist attention.
Oh, yeah. So you came to this realization on your own?
On my own, but it took my friend to really push me into therapy. Because as I was sharing with him, he told me, yo, I think from what you've described to me, this is not something I personally can help you with, but I know someone who can. And that's why I was referred to the doctor here. Ah, okay. Yeah.
Okay. So after you went to see the doctor, how did it wasn't hard for you? Because generally, in our country and in our culture, African culture, men are not perceived as, they're usually rather, let me rephrase that, they're usually perceived as weak when they maybe go to a counseling psychologist and they're like, oh, I need to speak to you about something. How was your perception of everything?
I'm an African, so that was also the perception I had. But then again, I'm not your average African. I'm a distinct African, I'm a distinct human being.
Yeah.
And I believe everyone goes through life their own way. And personally, the people I look up to also went through depression at some point in their lives.
Yeah.
So I didn't feel that stigma so much because I understood it's a fact of life. If the guys I look up to, for example, Elon Musk, also went through a depression and is like way, way greater than I am, who am I? So I wasn't really constrained with those cultural things. I would say guys my age, we are really growing out of that toxic masculinity that our fathers and our forefathers had.
And that's good.
Yeah, as you get more liberal, you travel, you meet people, you understand that this thing is normal.
Yeah. So what are some of the symptoms that, apart from, you know, asking yourself, who am I, who am I? I'm still at the same place where I'm asking myself, who am I, who am I? It sounds to me like it was not so bad, you know? So what other symptoms did you actually show and maybe your friend picked out during that time?
Actually, you'd be surprised, none of my friends knew I was going through a depression or stuff. Yeah, I used to show up to work every day. I'm a realtor, so I deal in property. I was making my quotas, but deep down inside, when I'm all by myself now is when I start those questions. Yeah.
And what kind of thoughts were coming to your mind?
The thoughts were, number one, I need to change this. Most importantly, I knew that I cannot progress with my life because I am a freak when it comes to planning. I love to plan my life day by day, if possible, even second by second. So that aspect that I lost control. So see, doing simple things like task. I'm an early riser by mostly 4:45. I'm usually up. So it started when 4:45 I can't wake up. So I found myself waking up at 6, which is pretty late for me. Then several months later, I can't even wake up at 8. I feel tired all the time. Then I felt the need to be always by myself. Naturally, I'm an introvert, but I became extra introverted. Yeah, so I just drew to my own self. I was from work to myself. And even when I'm in a crowd, I'm really not there. I might be there physically, but mentally, I'm in a different zone.
Yeah. And Daktari, these are some of the, you know, symptoms that you also did tell us last time. Maybe if you can, you know, give us, what was it that was more positive? What made you happy when you actually first came to see Bwana Njau here over, you know, the progress?
Okay. So when he first came to see me, there was a bit of anxiety from his side, the fact that he'd come to see a psychologist. And I had to do a lot of normalization to tell him, yes, it's okay, you've taken the first step, you're in the right place, and let's talk about how you're feeling. Then it took on from there. But what I would like to mention is that somewhere around the 5th session, Njau mentioned to me that, you know what, I don't know what I would do without these sessions.
Wow.
Yeah, I remember him mentioning that. These sessions have helped me a lot. I'm more aware of my emotions, and I'm a mental health advocate, and I would like to tell other young people out there that if they are undergoing certain symptoms which suggest that they have depression, then they can always go and seek help. And that is when he also assured me that, you know what, I'm there to talk about my experiences. If you ever need me to talk about my experiences of depression, I will always be there. Yes.
Okay.
And that is part of the reason as to why he's here today.
As a mental health advocate. Congratulations to you, Njau. How would you say you're now managing after, you know, seeing the good Dr. Tima Khamis here? How would you say you're now managing?
I will say I'm 85% back to my usual self. Yeah, it's a process. The one thing I'll say therapy has helped. Therapy is actually a self-medication process because the doctor has no magic wand. She can't just wave it and you're all better all at once. 90% of therapy is you working on yourself. The doctor only does the 10% to guide you the right way where you're going to now go back to the track you wanted to. But most of therapy is you being in tune with what triggered that experience in the first place, knowing what to do when such a thing occurs, and how to move on. Yeah, so most of therapy is you. Therapists, they're just to guide.
And how long have you been in therapy?
This is my 5th month, should be. Yeah.
Oh, just 5 months?
That's 5 months.
Wow, and you're 85% well.
Yep.
I believe the good doctor does have a magic wand anyway. But if I may come to you, Daktari, now, I ask you, last time before we ended the show, we were talking about, the Muslim, religious leaders just including some sort of advice and push to the community to actually embrace, mental health as a topic of discussion and actually seeing to it that, the public knows it. What's your 2 cents on it? You actually wanted to contribute on it.
Yeah, as I mentioned earlier, because of the stigma that's associated with mental health, yeah, it's very important for that collaborative approach. So this involves mental health professionals, it involves the religious leaders, it can involve the government, parents, schools. It's a collective approach. So when it comes to the religious leaders, I think maybe one of the things that can be done is to invite religious leaders here, for example. Let them talk to you about what they think mental health is all about, yeah? And then that way, the Muslim community can hear what mental health is all about, what stigma is associated with it, and also there needs to be a lot of normalizing when it comes to mental health within the Muslim perspective, that it's okay. You can be a practicing Muslim and still undergo mental health difficulties. Yeah. So I think that is the first maybe step to take as far as involving religious leaders. Yeah.
And Joe, if I may ask you, wewe kama kijana, what do you think can be done in order to, rescue this awareness gap that we have on mental health issues and disorders?
I'll honestly say it needs to be, I wouldn't say exactly normalized, because I don't expect it to change overnight where people change their views on depression. But I think people need to know it's normal. It's like any other disease. If, for example, you went to the hospital and you got diagnosed with malaria, you can't just ignore that fact. You'll seek medication as well. So depression is an illness. And like any other illness, it can be cured. So we need to understand that fact. It has nothing to do with witchcraft, has nothing to do with you being a lesser man, has nothing to do with, and it's an illness. You see, like malaria, you can't start saying malaria is witchcraft. Okay, people used to say that, but now you know it's not. So similarly, you just know it's an illness, and if you're sick, you go to the doctor, you get well, you get on with your life.
There's this question that came, to surface about money, cost of actually getting mental health help. How would you say that went for you?
I would say I'm lucky because, like I told you, I was already working. So for me, cost wasn't much of a barrier, thankfully. Yeah.
But how would you advise somebody maybe who cannot afford it, a youth like yourself?
I would say if you have someone, a mentor probably, because even me, I was helped in a way with my mentor in covering the cost. So if you have a mentor, someone who believes in you, you can approach them, see if they help you out.
Okay. Yeah. Okay. Thank you. I'll come back to you, Daktari, about the cost and everything. But let's just take a short break. Thank you very much for sharing that story with us. Let's take a short break. We'll be right back and head on to anxiety. Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakwetu wanatambua kama Mariam Mwacharo. Unatizama The Sabah Show.
تبارك الذي نزل الفرقان على عبده ليكون للعالمين نذيرا.
Ni kitabu kitukufu.
Qur'ani ni kitabu ambacho cha miujiza
Kilichoteremshwa kwa mpangilio.
Hazikuletwa harufu hizi za mkato moja kwa moja.
Hakuna mfano wake.
Na hamwezi nyinyi Makureishi kuwa ni wenye kutunga kitabu kama hiki ingawa zimetumia harufu zile ambazo zimezitumia katika kuandika au katika kusema.
Miujiza yake Al-Malik.
Mwenyezi Mungu ana uwezo usiokuwa na kifani.
Ni malengo ya Qur'an.
Khazain zote za ardhi na samawati ziko mikononi mwake.
Sheikh Muhammad Badamana na uchambuzi wa Qur'an kwa undani kila Alhamisi saa 3 usiku kwenye Horizon TV.
Horizon TV, the beacon for the nation.
Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakwetu wanatambua kama Mariam Mwacharo. Unatizama The Sabah Show. Shukran sana kwa kuendelea kutegea the premier Islamic TV station Horizon TV. Kumbuka kwamba line zetu ziko wazi. You can give us a call, you can send us a text message on the numbers on your screen, and you can also join the discussion on our social media platforms on Facebook, Instagram and Twitter at Horizontv Kenya, or you can join on my chat on Facebook at Mariam Kasim. We're talking about anxiety and depression. We just had a story from Bwana Njau pale akituelezea kwamba na ametuambia kwamba depression ni kama ugonjwa wa kawaida tu, ni kama malaria tu. So we should stay away from this belief that, oh my God, I cannot be suffering from this. This is the disease of the West. This is not the disease of Africa, just like Daktari last time told us. Now let's shift gears and come and talk about anxiety. Daktari Tima, I remember umetuambia kwamba when he first came to you, he had some symptoms of anxiety. But before we come to that, help us understand what anxiety is.
Okay. Anxiety is an emotion that we experience when we are anticipating danger or threat. Yes?
Yeah.
So we all experience anxiety from time to time. Now, it's different from anxiety disorders. Anxiety disorders are to do with excessive anxiety, which happens for a long period of time, and which can interfere with a person's quality of life. So there's a difference between anxiety and anxiety disorders.
Okay.
So imagine someone is preparing for a job interview. Then they would feel anxious. It's normal to be anxious. Yeah? Imagine, when I gave an example of Njao, when he first came for therapy, there was a bit of anxiety. And most clients who come to see me and who go for therapy, they would experience some level of anxiety because they don't know what therapy is all about. They don't know this psychologist who is in front of them. She's a total stranger. They don't know what to expect. So that sort of anxiety is normal. However, when we're talking of anxiety disorders, we're talking about something different altogether. Yes.
Yeah. And what is this, the anxiety disorder? Is it something that precedes a longer time, just like the way you say depression does?
Yes. And let me just start by the statistics.
Okay.
To do with anxiety disorders. So according to the American Psychological Association, anxiety disorders are the most common type of psychological disorders. All right? And 1 in 10 people suffer from anxiety. And according to WHO, 1 in 13 people globally, so that's all over the world, suffer from anxiety disorders.
Okay.
So you can see this is a common disorder that people experience. Yeah? So when you look at the most common mental health disorders, we're talking about anxiety and depression. This has been proven by studies that have been done, and from my own experience, I have seen that. Most people who come to see me present with anxiety disorders and depression as well.
I hear you say anxiety disorders. Are there types of anxiety?
Yes, there are types, different types of anxiety. Okay. Now, the first type of anxiety is called generalized anxiety disorder. Okay? So with this type of anxiety, there is excessive worry. And people worry over different things. Like someone would worry about what would go wrong at work, what would go wrong with their children, for example, what would go wrong at university. It's all about worry. And this worry is so excessive that it leads to a person feeling, the physiological symptoms will now come up. They will have regular and fast heartbeat, for example. They would start feeling like they're choked. Okay, they would sweat a lot, they would feel irritable, and they would have sleeping difficulties, and this can happen for a long time. The other type of anxiety is called panic disorder. Now, panic disorder comes about when people experience panic attacks. Yes? And with a panic attack, the symptoms include, sweating, heart beating very fast, feeling like they're going crazy, loss of control. There's a depersonalization, derealization. And it is such a scary, scary experience. When people undergo this, they feel like they're either going to die or they're going to go crazy.
Wow.
When this happens, yes.
That is intense.
Yeah. So when these panic attacks happen for a certain period of time, then the person would get a diagnosis of panic disorder. Okay? Now, we have other anxieties like PTSD, post-traumatic stress disorder, which comes as a result of experiencing a traumatic event. A traumatic event can be maybe if someone is involved in an accident, maybe you're involved in any other traumatic, sort of event, like you found yourself caught up in, like what happened at Dusit the other time. Yeah?
Yes.
So someone can easily get post-traumatic disorder as a result of exposure to a traumatic event. So the symptoms would involve flashbacks, nightmares, hypervigilance, and this can go on over a long period of time. Then we have obsessive compulsive disorder, whereby this is characterized by rituals, feeling the need to do certain things over and over again. And it's also a mean or a way of managing anxiety, because people who have OCD, the underlying emotion is anxiety.
Okay.
Yes.
Oh.
Yeah. So those are some of the types of anxiety. Then we have phobias. Okay?
Yeah.
Phobia is an overwhelming fear. And this fear can be fear of certain places, certain objects, certain situations, or animals. Phobia for a dog. Phobia for a spider. Some people fear spiders.
Yeah.
Yeah?
Yeah.
Yeah. Some people have a fear of flying. So whenever they get onto the plane, they would undergo certain physiological reactions. And this is because when people are anxious, there are certain hormones that are released from the brain, cortisol and adrenaline. When those hormones are released, then they have an impact on how the body functions. And that's where the physiological reactions come in. The heart beating very fast, sweating, feeling like you're choking, feeling like you're about to die. And you'd find that some people who experience some of these symptoms would first go to a medical doctor because they would strongly feel like they have a medical condition. Someone would think that maybe I have a heart problem, please can I have a medical checkup to confirm whether I have a heart problem or not.
Yeah.
And then that's when maybe the doctor will rule all the medical conditions, and then they will refer them to go and see a psychologist.
Okay.
Yes.
Wow.
Yeah.
So what are the symptoms that someone may display apart from the heart beating fast and you're sweating and you're feeling like you're going to die? These are all like in you. But if I look at somebody, can I tell?
Yes, yes. Yes, you can, like for panic attack, you can tell that someone is having a panic attack. Because they would start sweating, they would start breathing very fast, they would say that they have a lot of pain in the chest, they would feel like they're choking, and some of them would even say that, oh, I'm going to die, I feel like I'm going to die, or I feel like I'm going crazy, I feel like I'm losing control. So you can actually be able to tell that this person is having a panic attack.
Okay.
Yes.
And that's for panic attack.
Yeah.
What about these other types of anxiety?
Okay. Now, there's an anxiety called social anxiety, which is the most common type of anxiety. Okay? With this type of anxiety, and it's mainly experienced by the young people. Yeah. Social anxiety. And as the name suggests, it's this fear or anxiety that comes with being in a social situation. All right? So the person would avoid going to social situations because whenever they're in a social situation, they would feel like people are judging them. Yeah?
Yeah.
They would feel like they need to behave or act in a particular manner, and that puts them under a lot of pressure. And because of this, some people would avoid social places altogether because it's such an anxiety-provoking situation for them.
Okay.
With agoraphobia, it's fear of open places like market, for example, supermarket, being in public transport, the people who cannot, the very, yes, yeah. And this can sometimes even stop someone from maybe going to work, because whenever they get onto public transport, the symptoms start, you know, their heart beats very fast, they start sweating, they feel like they're choking, they have a headache, you know.
Yeah.
Yeah, so, and for some people, when you experience all these symptoms, someone can say, okay, I can't go to work because I'm experiencing all the symptoms. I'm better off staying at home, you see.
Yeah.
So that will stop this person from going to work.
Yeah. Let me, if I can come to you, Njari, remember when you were talking about your story, you said that there was a point in time you felt like you just wanted to be alone. Now, being a marketer, as yourself, as you said, a realtor, how did you, you know, juggle with these two balls?
I'm a workaholic to some extent. So for me it was easy because, you know, a client, there is nothing personal about it. I only just need to show up, make my pitch, then I'm out. So
You didn't have this some sort of inner turmoil or sort of some small war inside yourself?
I did, but bills got to be paid.
So that is what pushed you.
Yeah, so in a way I had no choice, man.
So, Doctor, if I can come to you, tell us some of the effects that anxiety may have to the patient.
Okay, the effects. So anxiety can stop someone from carrying on with their day-to-day activities. So if anxiety has stopped someone from going to work, for example, then that's a concern, isn't it?
Yeah.
Because this person feels like, I really need to be going to work. I have to make a living, but I can't leave the house because whenever I get out of the house, these are the symptoms that I get. Another thing is that anxiety sometimes can have an effect on someone's physical health. So if someone has undergone anxiety for a long period of time, they can end up getting cardiovascular problems.
Okay.
Yes, and we're talking about heart problems.
Yeah.
Yeah,
Yeah.
which can come about as a result of having anxiety for a long period of time. Yes. So that is where management becomes so essential. So as to avoid someone from getting into other complications. Yeah.
Okay. There's a question here on my Facebook that has arrived, and there's a lady, Zainab, she's asking, her grandmother has lost, her grandmother had like 10 children, and now that's the mothers and uncles, and she lost all of them except one every year. So can this, and sometimes when she sits down, she sort of have some short, you know, attacks, some panics, you know, and she starts complaining and her heart is beating fast, but every time they go to a doctor, she's fine, she's okay. Could this be a sign of anxiety for the grandmother?
Yeah, first of all, I'm so sorry to hear that. Yeah, I'm so sorry for the grandma's loss. Now, it depends, yeah, because anxiety, for someone to get a diagnosis of an anxiety disorder, they have to go to a mental health professional. I did mention this last time as well.
Yes.
For depression.
Yes.
You need to go to a mental health professional so that an assessment can be done, history can be done, and then a diagnosis made. In this case, it seems that she's already gone to the hospital. She's had some tests done.
Yeah.
Yeah, and the medical conditions have been ruled out. So it could be that there's something else going on. And given her history, yes, of all those losses that she's had, then it is possible that there's something psychological going on. So what I would advise her to do is to maybe take the grandma to a psychologist to have an assessment done, have a diagnosis, and then see what treatment she can be put on.
Okay.
Yeah.
Okay, let's take a short break. We'll be right back. When we come back, rather, we'll continue our topic on anxiety, and there's a very interesting question that has come into one of my social media pages. I'd like to ask that first to Jao and then to the doctor. See you in a short while. Remember, you can contribute to our discussions on our social media platforms on Facebook, Instagram, and Twitter at Horizontv Kenya, or chat with me directly at Mariam Kasim on my Facebook. See you. Bismillahirrahmanirrahim. Amani juu yako mtazamaji, wanakwetu wanatambua kama Mariam Mwacharo. Unatizama The Sabah Show.
Healthy Thursday is not just about diseases. It's about food, lifestyle, milestones in the medical practitioner's field, especially in our Muslim Ummah, and more so, your health. Discover breakthroughs and milestones in the medical field. Learn how to manage diseases. Join the discussion. Make better decisions on your meal plans. Improve your lifestyle.
All the doctors who are there were tired of working in maternity and taking care of women. And they say, you are the new kid on the block. We are leaving this department to you.
Healthy Thursday is a...
This is really important question for me. And I remember being at a development course where I saw this guy who was so laid back and he was so chilled out. I mean, the way he spoke, the way he walked, the way he did everything. So I thought, you know what? This guy knows. So I went to him and I said, you seem like a great, calm, chilled out person. Can you tell me, how do you stay like that when you're around annoying people? So he said something which was very profound for me. He said, I just remember that however they're behaving is about them and not me. Now I had to think about this for a second, but I realized he was absolutely right. Most of the time, when people are annoying us, it's because they're behaving in a way we believe they shouldn't. And subconsciously, we believe that it's related to us or it's our fault in some way. This, of course, isn't true, because however someone chooses to react is down to them and the choices they make. So let's take an example. Imagine that I came to you and I verbally attacked you and I abused you. How are you going to feel? You're going to feel bad, right? What if a few minutes later I come back to you and I say, listen, everything I just said to you, it's all about me. It's got nothing to do with you. It's because of the stuff that's going on in my life right now. How do you feel? Better, right? You feel better even though I didn't apologize. Why? Because I've told you that it's not your fault. So the way to be around annoying people is to remember that their behavior has nothing to do with you. Now, one last question before I go. If you think I'm annoying, who is that about? You, right? So the real question is, who is the annoying person? Jazakallah khair for watching. Assalamu alaikum.
Horizon TV, the beacon for the nation.
Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakwetu wanatambua kama Mariam Mwacharo. Unatizama The Sabah Show. Welcome back. Thank you for staying tuned to the premier Islamic TV station Horizon TV. I am taking a look at the social media platforms, and on my Facebook, definitely I have a couple of questions that have come in. Thank you so much for addressing that. Remember, you can also call us on the lines on your screen or even send us a text message also on the numbers on your screen, and we'll be getting back to you as we continue our topic today on anxiety after finalizing on depression. I see a lot of relation between depression and anxiety, but if I can ask, there's a question that came last time. Can a person with a mental health problem make sound decision?
Yes,
they can.
They can. When you look at depression, when people have depression, they can have indecisiveness, so they can have difficulties making decisions. Yes, so it might take them longer to make a decision, but eventually they will make a decision. But when you're looking at conditions like schizophrenia, which are serious medical conditions, psychological conditions, then yes, decision making can be severely impaired. And here we are talking of someone who also has hallucinations, whether it's visual. Okay, they're seeing things that other people cannot see. They have delusions. And yes, so the decision making can be an issue for people with serious mental health conditions such as schizophrenia.
Njau, if I can come to you, I remember ulipotuambia story yako, you said that none of your friends knew that you were depressed. None of them. How about your family members?
I didn't exactly tell anyone.
You didn't tell anyone?
No,
Why not?
Number one, because I didn't want to worry anyone. And number two, I thought it was too personal to tell anyone.
Really?
Yep.
On that note, Daktari, what role should family and friends, play for a mental health patient?
Yeah, so I hear that a lot, what Njao has just said. He didn't want to worry his family and friends maybe. And so the family can play a part in assisting with someone's recovery. Yes? And although the family might not really know what someone is going through, a family member is going through, unless they tell them what they're going through.
Yeah.
However, I have seen cases where family members have actually called me to book appointments for someone who they think is struggling with one thing or another. Yes? So that's usually a first step where family members can offer that support. Secondly, understanding. So here is a family member who is undergoing depression, for example. So how can family support this person? Try to understand, yes, that this person is undergoing a difficult time. So listen to them if they, if they come and talk to you and share what they're struggling with. Offer them support and don't behave so differently towards them, because sometimes when the family members realize that one of them has a mental health condition, it would be as if they're walking on eggshells. Yeah. And when the person who is suffering from depression realizes this, then they would feel uncomfortable and start wondering, oh, why are these people behaving like this?
Yeah.
Am I so unwell that people are behaving like this? Such things. Yeah. And also another thing is patience. Patience is so important, especially with people who are suffering from depression, because this is someone who has all these symptoms of maybe isolation, lack of energy to do anything, lack of motivation, negative thinking, towards themselves and towards the world. So whatever family members might try to do might be received with either negativity. So you need to be really patient and walk the journey with this family member. And yes, and also express that concern that if you need to talk, we are there.
Yes.
We are there to listen. And no labels. So if someone is undergoing depression, it's not nice for family members to keep on referring to that person as, you know what, you're having depression, that's why you're doing this.
Oh, yeah.
You know what, you and your OCD, this is too much now, you keep on arranging things, you keep on doing things here and there. So those labels, and also not pushing them to do things that they're not ready to do. So if someone doesn't feel like going outside, it's one step at a time. Don't push them to go out. Go with them slow, and they will get there eventually. And most importantly, taking care of yourself, because if you're taking care of a family member who has depression, then that will have an emotional toll on you. So it's so important for you to take care of yourself.
Let's talk about access to medication, Daktari, and the importance of accessing, medical assistance when it comes to anxiety. As I already asked Njao, he said for him it was not a problem because he was working. But, there are people who are possibly, depressed or have anxiety, but they cannot afford or do not have access to medication.
Yes, that's a very good question, because mental health care on its own comes with a cost. It's expensive. It's expensive to go and see a psychiatrist. It's expensive to go and see a psychologist. It's expensive if you have been put on medication. Yes?
Yeah.
So, what I can say is this. When it comes to medication, it's so important for the patient to discuss with the psychiatrist. Yes? What medication they've been put on, how much the medication is going to cost, and think of alternatives. Because some medications cost, a lot more than others. Yes? And also, this is so important because there are certain mental health conditions that require someone to be on long-term medication. So you just have to take medication. There's no two way about it. Because when it comes to treatment, there are psychological interventions and pharmacological interventions. So when you look at severe depression, when you look at schizophrenia, when you look at severe anxiety, these are conditions that require medication. So the person would benefit from taking this medication. So the other alternative is to maybe get, you know, insurance, medical insurance. And this is where maybe NHIF can come in, or involve other family members to see how best they can support when it comes to treatment.
So it's very important
It
that
is
they
important.
get treatment.
For certain for certain psychological conditions, it's also important for, if the psychiatrist has said that you have to be on medication, then yes, it's important for you to take that medication.
Okay.
In addition to psychotherapy.
Okay.
Yes.
Okay. And does one completely get cured from, say, anxiety? Does one completely get cured
from anxiety?
Yeah.
Again, another good question. So, with anxiety, people do not necessarily get over anxiety completely because of what I mentioned earlier on.
Yeah.
Anxiety is a normal emotion that we all experience. It's just that some people tend to get more anxious than others, and this same anxiety can lead into one developing anxiety disorders. Yes? So what people who have anxiety disorders do when they go for therapy is that the psychologist teaches them how to manage this anxiety. How do you manage this anxiety? And then the psychologist also will teach them certain relaxation techniques. Being aware of the triggers of anxiety. What are some of the triggers of anxiety? They will be also taught how to be aware of their own anxiety. Emotions, all right? Yeah. So eventually, they will learn how to manage their own anxiety. But anxiety cannot completely go away.
Okay.
Yeah.
Njau, let me ask you a rather simple, difficult question, okay? Comme si, comme ça. You are a realtor. You work, of course, for a company, and you have suffered depression at some point of your life. It could be before you started working or during, you know, your time that you're working. These companies, do you think they should provide avenues for, say, stress relief, anxiety relief? What's your thoughts on it?
Most definitely. I think moving on to the future, employer-employee relationships will change. The employee will be seen first and foremost as a human being, first, then an employee later. And once they realize that, and I was lucky in my case, that was what happened, they realized that I have been performing. Save for the depression that I suffered, I was a good enough worker, I was meeting my quotas, I was doing what was supposed of me. But they realized that it's because of that condition at that moment that's why I was not performing. And they were understanding. I went on a 6 months hiatus.
Wow.
And they understood. And the friend I'm talking about is actually my boss, but now he's more of a friend than a boss.
Yeah.
So, like I say, my situation is a bit
different.
I was lucky in that way. I don't think most people will have their bosses understand why haven't you been coming to work for 6 months. You haven't been picking your clients' calls, what's up. That is a no-no for most employers. But in my case, my employer was really understanding. And he saw me first as a human being rather than his employee. And I think most employers need to do that. You see your employee first and foremost as a human being.
Okay, that's very important to mention, and that's now the question I would like to address to you, Daktari. What do you think the private sector, the public sector should do in order for, you know, to have employees be seen as human beings first, as he said?
Yes, that's also important, to be honest. For the employer to really consider the employee's mental health and well-being. Yes? So, certain strategies can be put in place at the workplace. Like, for example, having a counselor at work. So that when people feel like they're overwhelmed, they can go and talk to this counselor. Other strategies that can be put in place are workshops. And there are psychologists who specialize in corporate, you know, and they would go to different organizations and offer workshops on stress management, mental health awareness, and all that. So that's also important as well. Yes? And also, most importantly, it is for the employee to have an open sort of relationship with employer-employee relationship. That's also important. And that's what Njau benefited from.
Yeah.
Yes?
Yeah, from his boss.
Yes, yes. You know, the boss is the one who actually convinced him to go for therapy. How many bosses would do that? I wish more and more bosses, more and more employers can do that.
Yeah.
Yes.
Yeah.
And really take into consideration their employees' emotional well-being.
And this is why I think some of the companies we usually see, they have stress relief rooms and they have, you know, playrooms, and people think, oh my God, these people are joking.
Yeah.
But they're actually taking the mental health of their employees into account.
Yeah.
Dr. if I may ask you, which is the most vulnerable group to anxiety according to research and according to your experience?
Young people.
The young people?
Yes.
Between what ages? Can a 10-year-old be prone to anxiety?
Yes, children and young people. Yes. So if you look at the children, for example, the anxiety that they experience most is separation anxiety, whereby a child would not want to be separated from the caregiver, whether it's a parent, grandparent, you know.
Yeah.
Yeah. So, for example, if they're taken to school, they become very emotional. They would throw tantrums because they've been separated from the caregiver. Yes. And then there's another type of anxiety called selective mutism, whereby a child will refuse to speak when they're at school because they're anxious.
Oh.
Yes, so they will refuse to talk completely.
So they go mute?
Yes.
All day?
Yes, all day. Not talking. Okay? Yes. So that's with the children. Those are the most common anxiety disorders amongst the children. And when you move to the young people, the most common anxiety is social anxiety. Social anxiety. And research has also demonstrated that. Why is that? Because, you know, young people are under a lot of pressure.
Yeah.
To meet certain expectations, okay? Yeah, to perform.
Yeah.
And these expectations are there at school, in college, university, at home, and within the society at large. Yes.
So they could easily throw someone into anxiety, depression.
Yeah. So you'll find most young people present with social anxiety.
Okay.
Yeah. Okay. And also another thing, fear of failure. Fear of failure. That has become so common amongst young people. Yeah. They just want to pass and they want to see themselves excelling.
Yeah.
And failure just throws them down yeah, to a different level.
Yeah, people do not know how to take failure, yeah?
Yes, yes.
There's a message that has come to us, Ali. He says, Assalamu alaikum, Maryam, wa alaikum salam, wa rahmatullahi wa barakatuh. My name is Ali. I've been having anxiety for the last 2 years. It comes and goes. So he's asking for assistance. And I remember when we were speaking last week, but one, when you had a forum here, you said, for this month and next month, you'll be offering, you know, free counseling. So maybe we can have Ali come and see you, inshallah. So Ali, a very good psychologist here, is offering free counseling for this month and next month because it is mental awareness month and also World Suicide Prevention Month. So we will get back to you with that, and you can have psychologist Tima Khamis see you. Last question: what are the facts about mental health, specifically depression and anxiety, that people do not know, Daktari?
Yeah, so the alarming statistics that are there,
yeah,
you know, the alarming statistics, yes, because when you hear that 1 in 10 people suffer from anxiety, you know, that is alarming.
Yeah.
Yes.
Yeah.
And another thing is the fact that now anxiety is considered to be a public health concern.
Oh yeah?
Yes, it is a public health concern, all right? Because of how it affects mainly children and young people. And most of these children and young people go undiagnosed. And if this anxiety is not treated, it can lead to anxiety, to depression. And that's why sometimes you'll find that anxiety goes along with depression.
With depression,
yes. So you find someone having depression and anxiety.
Yeah.
Yes. Yeah.
And I think I can relate this to also the fact that, you know, in every 40 seconds somebody commits suicide.
Yes,
you know,
yeah.
because it is also a side effect of anxiety.
Yeah.
maybe if I may go to Njau first before I come to you, Daktari, on my very last comment. Njau, what would you like to tell your fellow youth, brothers and sisters out there, over the whole general topic about mental health, having experienced depression yourself?
I'll say this. We all have one life to live. We have a very finite, these days getting to 60 is a blessing.
Yes.
So life is precious. And depression sucks the life out of life. It leaves you miserable, it leaves you pessimistic. And I believe that's no way of living. You should be able to look forward to every morning as if it's your last day, and you should be able to live to your full potential. Do not let depression get in the way of you living to your ultimate potential. Yeah, that's forget about what people say. At the end of the day, it's your life. The toxic masculinity might make people like me look like we are crazy or something, but at the end of the day, it's my life. I know what I want with my own life, and I will not let something that I can't control deter me from living the life that I want for myself.
Definitely.
Yeah, so be selfish, love yourself, take care of yourself, and pursue your dreams.
YOLO.
Exactly.
Daktari, before we end, before I come to your last remarks, next week, inshallah, we'll be doing delivery and postnatal care. Now, there's a question that came onto our desk after last week's program and this week's program. A question has come in, and they ask, can anxiety, maybe can a mother who's expecting a child and maybe during the delivery process and after delivering, could they possibly fall into depression or, acquire anxiety during that period?
Yes, it's possible, yeah.
Because of?
It's because of a number of reasons, to be honest, So if you look at genetics again and previous history of depression, yes, it is possible for someone to get depression while they're pregnant and even after pregnancy, once they've had the baby. And postnatal depression is the depression that people have after delivery. And yes, it's someone who presents with postnatal depression will be very sad, experience a lot of sadness, no connection with the baby. Yeah, there'll be no connection with the baby. They would feel like same symptoms, that are presented with people who have depression. Lack of energy, lack of motivation, negativity. And it's also essential for someone who is undergoing postnatal depression to seek, psychological help. Yes. So whether it's going to be medication or whether it's going to be psychotherapy, but it's so important for them to seek that help. Yeah.
Thank you very much. Last remarks, Daktari, from you?
Yeah, my last remarks really are to do with Njau. I would like to say a big thank you to Njau for coming to this show today. Yes, it's amazing and it's exceptional for you to share your experiences with the viewers out there, because as you mentioned, depression is real and anyone can have depression. It's not a sign of weakness, and it doesn't make you less of a person. So thank you so much on behalf of Mariam, the crew, and Horizon in general, a very big thank you. And I hope you are a source of inspiration to the young people out there.
Yes, I'd also like to say thank you very much for sharing your story, for giving advice. Definitely, this is something big. And for Ali also for reaching out to Horizon TV. We'll definitely be connecting you with the good doctor here, Tima Khamis, psychologist, and she's gonna help you, inshallah. Thank you so much. Thank you so much for gracing our show today. Thank you so much for coming. To my team, thank you very much for facilitating this show. Our technical operators, our sound guy Sadiq, thank you very much. And to my producer Bab Kubwa Shakombo, thank you very much for facilitating this show. For me, to you, ma'asalam to you.
Horizon TV, the beacon for the nation.